Welcome to the Health Promotion Ambassadors Orientation Training for the Test, Trace, Treat Reentry Plan at the University of Arizona for the fall of 2020. We all want to get back to school and back to work safely. In order to do that, we need to keep each other healthy. That's the mission of the University of Arizona Health Promotion Ambassadors. The success of the university's reentry plan for fall 2020 depends on students. If we all follow the guidelines, we'll be able to return to school and to work safely. We need to build a culture of health promotion among students, a sense of shared responsibility. Together, we can crush COVID. The goal for the Health Promotion Ambassadors is to support this effort so that our campus remains open for in-person learning, teaching, and research. We know that a safe return to campus depends on students. Let's go over the topics for this training. First, the basic prevention guidelines. We talk about them over and over because they work. So simple, so effective. Face masks, physical distancing, washing hands. If everyone followed those simple rules, the virus could not find new hosts and the infection rate would plummet. At the University of Arizona, we also have other tools, the COVID Watch Arizona exposure notification app and the Wildcat WellCheck texting-based communication system. We'll talk about them both in more detail. We will also cover all the components of the university's Test, Trace, Treat strategy, a combination of programs and systems designed to stop outbreaks of COVID-19 in the campus community. Finally, we can't emphasize this enough. We need everyone to participate. That's how we stay safe. That's how we stay open. How do we stop the virus? Together. We keep each other healthy. The university has provided 4 simple steps for the return to campus. Number 1, get tested. There is free testing at sites around campus. Number 2, mask up. Everyone needs to be wearing their face covering. Number 3, download the COVID Watch Arizona app, the anonymous exposure notification app. And number 4, join Wildcat WellCheck, the texting-based communication platform for campus health. These 4 steps and all the information in this presentation can be found on the University of Arizona website. Just go to covid19.arizona.edu to get started. If we don't follow the guidelines, we risk having an outbreak that could shut down the campus. But together we can stop COVID-19 in our campus community. We need to maintain social distance, make sure that we wear face coverings when we're inside buildings or outside when social distance of 6 feet is not possible. We need to stay home if we feel sick or have symptoms. There are videos that show how you can do your part and what the expectations are for in-person classes. Now we're going to talk about the Test, Trace, Treat 3 T's strategy. The 3 T strategy is designed to stop COVID from spreading among the University of Arizona community. The testing is vital to identify who is infected. Remember that up to 40% of people who have an active infection show no symptoms. They don't feel sick, but they can spread the virus. We need to identify the people who have an active infection, isolate them so they can't spread the virus to others, and alert the people who may have been exposed to individuals who tested positive, so they, in turn, can self-quarantine, get tested, and stop the spread. That's how we can stop the infection from spreading in the campus community. You can learn about all the different components of Test, Trace, Treat and how they work together on the university's website. We're going to talk about them here. First, we'll talk about testing. Testing identifies who has an active viral infection and clears those who don't have the virus, so we can all stay safe. There are 3 types of tests. 2 of the tests are for active infection, the antigen test, which has a quicker turnaround, and the PCR test. The antibody test is a 3rd type of test. That test shows if a person has antibodies, which would show that they have previously been exposed to the COVID-19 virus. Testing for active infection is vital. Remember, up to 40% of people who have an active infection don't feel sick or experience symptoms, but they can still be spreading the virus to others. By testing, we enable the isolation and treatment of those who have tested positive. Positive testing also starts the contact tracing process to identify people that may have been exposed to the virus so that we can stop the spread. What do you do if you test positive for COVID-19? First, isolate yourself so you don't continue to spread the virus to others. You'll receive support from the university during isolation, and you'll be given treatment if needed. Self-report. This is vital. Everyone who tests positive needs to self-report to the University of Arizona contact tracing team. Time makes a big difference here. There's a simple self-reporting survey you can complete on your phone. That will help to keep others safe and slow the spread. When the University of Arizona contact tracing team calls, answer the phone and work with them to identify friends or other community members that you may have been in contact with. Remember, most of the contact tracers are your fellow students. They volunteered for this job in order to keep the university open. Now we're going to talk about the trace component of the 3T strategy. The idea behind trace is to track down, trace, and alert anyone who might have been exposed, a contact, to a person who tested positive for the virus. We're tracing the contacts, contact tracing. There are 3 parts to the trace component of the 3T strategy. Number 1, traditional contact tracing from the University of Arizona contact tracing team. Number 2, the COVID Watch Arizona exposure notification app. And number 3, the Wildcat WellCheck texting-based health reporting system. We'll go through all 3 of these one at a time. Traditional contact tracing. This method of stopping disease is proven and established. It's a reliable method to stop the spread of disease, and it's been used for decades by public health experts around the world. The University of Arizona's contact tracing team was established at the Zuckerman College of Public Health. Powered by student and staff volunteers, they reach out to individuals who tested positive, identify others who may have been exposed to those individuals, and then reach out to those people who possibly have been exposed to advise them on next steps. This method keeps us all safe and stops the spread of the virus. It's important to remember the success of traditional contact tracing relies on cooperation. When we work together with the contact tracing team, we're helping our friends, we're helping our community, we're helping the university stay open. One of the ways we can figure out who was possibly exposed to the virus is through the COVID Watch Arizona exposure notification app that uses Bluetooth technology. It's completely anonymous. This technology was made available by Apple and Google for iPhones and Android phones. The app uses Bluetooth signals to identify other phones that have been near your phone. If anyone reports that they have received a positive test through the COVID Watch Arizona app, the app will automatically notify others who were close enough to those who test positive for long enough to have possibly been exposed. That's why it's called an exposure notification app. It's a way to warn people that they should get tested, that they should isolate, and that they may have been exposed to the virus. Again, the COVID Watch Arizona app relies on participation. Everybody needs to download the app, and then they need to self-report if they test positive for the virus. This will help us all stay safe. It's important to know that the search terms for the COVID Watch Arizona app are different on iPhone and Android phones. If you have an iPhone, go to the App Store and search for COVID Watch Arizona, 3 separate words, to find the free download. If you're on an Android phone, go to Google Play and search for COVID Watch, 1 word, to find the app for the free download. The third part of the trace component is Wildcat WellCheck. This is a texting-based system for self-reporting health status. It's not an app. There's no download needed. Wildcat WellCheck delivers custom information from Campus Health. Essentially, Wildcat WellCheck is an information exchange channel with Campus Health, so we can make sure that everyone has the services, support, and answers that they need. Everyone needs to join and report their health status daily. This is required by the University of Arizona if you're going to be on campus. Again, Wildcat WellCheck relies on self-reporting and participation to be successful. If we all work together, we crush COVID. And finally, if you got a test for COVID off campus and you received a positive test, you should call Campus Health to report. The direct number is 520-621-9202. To review, the three parts of the TRACE component are 1. Traditional contact tracing, 2. The COVID Watch Arizona exposure notification app, and 3. Wildcat WellCheck, the texting-based health reporting system. More information on all of these can be found on the University of Arizona website. Now we've reached the third component of the 3 T's strategy, treat. We need to treat people if they test positive. Campus Health leads the treat component for the 3 T's. Those who test positive for COVID-19 will be treated with wraparound support. They should stay home and isolate to stop the spread. They should self-report to Campus Health and to the University of Arizona contact tracing team. You can go to the Campus Health website to learn more. They will provide guidance, answers, and healthcare support. Altogether, the test, trace, treat strategy enables the university to slow and stop the COVID-19 virus from spreading among the campus community. Using the 3 T's approach will alert students and staff if they've had a possible exposure to the virus. It will enable us to test quickly to find out if individuals are infected. It works by rapidly identifying those who tested positive for the virus, isolating infected individuals for treatment so they don't spread the virus to others, and then alerting community members who may have come into contact with the person who tested positive so they can self-quarantine and get tested. This proven process mobilizes information systems to stop the spread of the virus. The 3 T's strategy is designed to prevent outbreaks so we can keep campus open, so we can all keep teaching and learning. If we all work together, we stay safe, we stay healthy, we stay open. Again, remember the 4 simple steps that everyone should follow for the return to campus. Number 1, get tested. There's free testing at sites around campus. Number 2, mask up. Everyone needs to be wearing their face covering. Number 3, download the COVID Watch Arizona app. And number 4, join Wildcat WellCheck, the texting-based communication platform for Campus Health. Thanks for taking this training and helping to keep our campus community safe. Remember, this is a challenging time for all of us. The return to campus can be intimidating, and the test, trace, treat strategy can be confusing. Some members of our campus community may have friends or family who are very sick from COVID-19. Some may have lost family members due to the virus. As you help to guide your fellow students and the whole campus community, remember to be thoughtful. Remember to be compassionate. We all need to support each other through this challenge. Finally, remember our mission. We keep each other healthy. If we all work together, we stop the virus. And remember our goal. Our campus remains open for in-person teaching, learning, and research. Mask up, bear down. And together we can crush COVID.